But today we are so happy to have Dr. Palmer here with us to share with us on Hawaii telehealth, how it can be a very valuable resource for our providers out there. He is our co-medical director of Hawaii telehealth at AHEC and JABSOM. Without further ado, I will stop sharing. Thank you, Dr. Palmer.
Well, it is my pleasure to be here, and I'm so happy that Dr. Withy asked me to do this presentation. And I am, but before I dive into that, I've got to tell you about my fun and exciting adventure. So my daughter decided about 2 weeks ago that she wanted to see Elton John's last show. Hey, can you guys hear me okay? Am I being heard okay? Okay, good. So she wanted to see Elton John's last concert, which was supposed to be last weekend in Stockholm, Sweden. And so we have the opportunity to fly standby. And so we were going to go do that. And so we're getting on our flight. We're heading in. We were going to fly into Germany and then make our way up to Stockholm from there. And as we were getting on the flight, I asked my daughter, I was like, hey, have you ever printed those tickets yet? And she says to me, Dad, I'm having a little problem with the app. We had to get on, this was right before we get on the plane. And so we get on the plane and we land in Germany, and I'm like, okay, we got to figure this out. And turns out we got scammed. These were she bought the tickets on StubHub. So we didn't have tickets. We're all the way in Europe, and we're not getting to the show. And anyhow, so we decided, I had lived in, we had both lived in Stuttgart, Germany for 4 years. And so we decided, we had a rental car. And so we drove down to Stuttgart, basically spent the weekend catching up with friends, and then basically turned around and come back. But that's, but it was great. With the pandemic, hadn't been able to get over to Europe in a good number of years. And so it was a good way to reconnect with some people that we wouldn't have reconnected otherwise. So, and rekindle some friendships. So that was great. So even though we got scammed on our tickets, whatever, got to see. And I see someone said, you're a cool dad. And that's the thing. She's 20 years old. Got to do some great bonding with her, now that she's kind of getting out of those high school years. So it was really nice to be able to have some one-on-one time. So that was wonderful. And anyhow, so so that's my story.
Did StubHub get your money
back?
Did StubHub refund you?
StubHub has not refunded, but luckily we paid through PayPal, and on PayPal paid with a credit card. So either between PayPal or American Express, we're gonna get the money back. Okay. But yeah. So yeah, but yeah, it was and so that was fun to do. So let me pull up my presentation and hit share screen, and let's see. So desktop, share desktop. Hold on. So apparently I didn't give Zoom preferences to share my screen before, so my apologies. Why is this doing that? I'm hitting share screen.
Do you want me to share what I have?
If you don't mind, yes, you have the second one I sent you is exactly, it's no problem. So if you're able to share that, that would be great.
All right, let's see. Just gotta find it here. All right. Here's the revised version. And All right.
Glad we have a backup.
Share it. Always good to have a backup. Where did it go? Okay. Here's the email. Yes, yes. Here we go. All right. It's opening. That's not it. That was frustrating. Okay. Download it. I'm going to open it. And then I'm going to try sharing it again. I see it. And let's see if you can see it now. Wow. Okay, full screen. What else? Full screen, screen view, shape,
Put it in presentation mode.
view, presentation. Show presenter notes. No, where is presentation mode? All right, somebody on the call is going to help me. Animate. Look at this. Somebody going to help me? Slide only. How about that? What's over here? What about this stuff?
How about if you
How do
press
I get rid of
play
this?
at the top?
Play. Ooh. Ooh. Pat on the back.
Yeah, good.
Okay, you go. What, Summer?
There we go.
All right. Okay, Wes, you're on.
All right. Okay. So thanks, Dr. Withy, for bailing me out on the presentation. So I'm going to talk to everybody today about the Hawaii UTelehealth program. And looks like we're on our goal slide. So Hawaii UTelehealth is about 3 years old. It started partly out of COVID funding, and a compilation of basically a consortium of groups got together, and with the goal of providing telemental health to folks in Hawaii, and particularly to try to decrease some of the burdens and the barriers that exist around mental health. A lot of people will find that it's a little bit takes too much time to away from their day to go to an in-office appointment. Sometimes their insurance is not paying for the full suite of services that folks need. And then if you're in a rural area, it could take a long time to get, and just from just trying to with the transportation side of things, to access services. So through some generous grant funding from a variety of sources, Hawaii UTelehealth been able to provide at zero cost to people in Hawaii, both rural and urban, telemental health services. And this funding is going to continue, at least for the rural population, through 2026. Right now, the urban funding, which will be only a portion of Oahu, some of the windward side of Oahu, will lose funding in 2020, in September of 2023, unless some other funding is identified. And I know Dr. Withy is working on that. So so that is kind of the goals around the program. Go to the next slide, please.
Oh, good. I did it.
Yay. So our services are to provide telemental health with licensed clinicians, and that could be a psychologist, psychiatrist, family medicine docs who provide counseling, mental health counselors, and substance abuse counselors. Right now we have 13 counselors or providers, I should say, who participate in the program. We're about to bring on a 14th through the existing contracts that we have. I do want to make a special note that we are opening up a request for proposals to bring in additional providers here who are licensed in Hawaii. We particularly are looking for those who provide services for children and adolescents, both counselors as well as psychiatrists. We actually have an acute need for child psychiatrists, but this RFP is going to be open for anybody, because as I go forward in this presentation, we'll talk a little bit more about how we want to continue to expand our offerings and our services. So as I mentioned, this is a consortium of people and organizations who've gotten together to pool resources, both from a fiscal standpoint as well as workforce standpoint. First of all is the Hawaii State Rural Health Association. Then, of course, John A. Burns School of Medicine under the guise of Dr. Withey's organization of the Area Health Education Center, otherwise known as AHEC. And of course, our community partners who are coming on board to bring this. The suite of services provided are, your wide ranging. Typically, a lot of what is, I guess one would say, kind of bread and butter mental health care, stress, anxiety, depression, but also getting into substance abuse issues, and as well as those with more acute concerns about self-harm, and being there to provide those services. Next slide, please. There are some resources required to make this work, and sometimes those resources can become barriers to those who aren't familiar with that, and that is being connected electronically, being part of the digital age. And not everyone is savvy in that. We could stereotype and say it's our senior citizens, but I mean, there's a number of people. You don't have to be a senior citizen to not be a digital native. And you do need a computer or smartphone that will connect to the internet, as well as an email connection, so that people can get in contact with you and provide the necessary forms that need to be signed and signed off on. However, we recognize that this can be a barrier, and we work to mitigate that through a team of community health workers on most of the islands, the Big Island, Maui, I believe, and Kauai, and also have the opportunity and the funding to travel to get out there to get people set up. If someone is not literate in using a computer, there's also a computer trainer on staff, as well as if one does not have the equipment, there is an opportunity to get some old equipment. Well, not going to be the latest and greatest, but at least equipment that can connect and provide that connection. So that
it is professionally refurbished.
And professionally refurbished. So it's not, it's not on its last legs. It will continue to work. This is our latest.
There's two chats, and I can't read them because I'm because I've got the presenting screen up.
Let me open up the chat.
Yeah.
Okay.
Go ahead.
Renata asks, does the provider or clinician need to be physically in the state of Hawaii if they have a Hawaii license to provide services?
And right, and so the answer to that is no. You do not need to be in the state of Hawaii. And we'll just leave it at that. So yeah, you can be outside the state as long as you hold a Hawaii license. You provide care to people within the state of Hawaii, and the care and the provision of care is where the person is located. So even if they're not a resident of Hawaii and they see this, they want to call, they could start to establish care. But obviously for something like this, you want continuity of care. But that is out there. Also, these are these flyers that you see in the presentation. These are our latest flyers that we have out there. So that those numbers are correct. So if you want to refer people as well, for whatever reason, please take note of that um, for your resources. Okay, next slide, please.
Oh, that's me.
Yeah. All right, and so and then on the topic of latest and greatest flyers, this is then the flyer that we use for those who need some skills development around using the computers and or getting the refurbished computers. So, and of course the numbers to call for that. All right, next slide. So this slide is about who's getting the services. So currently we're providing care to about 130 patients, and that would be the total cohort. There's roughly there's about 250 visits per month being done, perhaps a little more. That number waxes and wanes, and we're getting about an average new patients or clients per month. And when I say average, sometimes it's more, sometimes that's less, and that's based off of the last 6 months figures. And we're primarily serving rural Hawaii. Our urban Oahu patients may be getting one new patient a month in the last couple of months. So the bulk of our patients are from the rural area. So our target, and if that, if we're not able to continue that urban funding, the impact is not going to be that big because of our current patients being mostly out of rural Hawaii. The next slide will show you a bit of that breakdown. And you can see where they're coming from. These are from one of our partners that out of the Touch Grant. We don't have Oahu figures on here, but you can see of the outer islands where our utilizers are coming from. Next slide, please. So we do have some ambitious aims as part of this program, and that's to continue to expand telehealth infrastructure to rural individuals in Hawaii, and I will even say I'll extend that and to say once the concept is proven, and as we continue to refine our offering, we'd like to get this out into the broader Pacific area, into Guam and Saipan and some of our U.S. affiliated Pacific Islands. If licensing and those sorts of issues can allow, but by testing the concept with the infrastructure and scaling it up and doing that, once we feel confident that we've succeeded here in Hawaii, we see this as a proof of concept of being able to then export this. And we want to make sure that, this is quality care, right? I mean, just because we're doing this through telehealth, we want to make sure that, the care that our rural folks and those that are getting this care, this is just as good as any other care that they could get. So we want to make sure, that there's good access, that there's good care coordination with those that do have that, and we have some metrics around some of the hours and that we want to see and that we're targeting. And then of course, people don't live in isolation. They are impacted and by the communities within which they live. And so having understanding of that, having providers that are part of the community, or at least have been part of the community or understand the community, are important to also helping to address some of the social determinants of health and some of the community outreach programs that we want to have as part of the funding and the programs that we have. All right, so that's some of the aspects that we have. Getting a little bit more into the as far as our our ALICE patients, and tracking that. We're exceeding some of our goals around who we're providing care for. We've had a lot more than planned, and it's just and really this slide is just to show that we're looking at those social determinants of health. We want to make sure that the services are being offered to all, and that we're making that available. And I think these numbers at least help to validate the fact that people are utilizing the services, and people that do come from traditionally underserved communities are using the services as well. And so it just helps to know that the barriers to care perhaps aren't there. Maybe that's a blind spot but at least this data would help us to see that that those underrepresented communities are being there. I do see a question coming in. Is there special consent from Renata? Is there special consent given to patients when a learning clinician is training? Right now, all of our providers are our providers that are seeing patients are fully licensed and not in training. If those providers were using someone who is, that would be an individual sort of session. If someone was having a student or a provider in training as part of the process, there would have to be an individualized consent, at least from a verbal standpoint, that patient was there. Next question from Sherry Simmons: who is eligible for service? Need a referral? I may have missed it. As long as you're living in Hawaii, you are eligible for services right now, and then in September 2023, you have to be living in what's considered a rural zip code within Hawaii. So that's basically any of the outer islands, or west Oahu being like Waianae, Nanakuli area, North Shore, and Waimanalo would be considered part of rural Oahu as well. Okay, on to the next slide. So what are our way ahead? As I talked about before, we want to continue to expand our provider panel, particularly for our child and adolescent providers. But any provider is welcome to put in and for our request for proposals. That request for proposal is about to hit the streets. It was supposed to be done last Friday. We're hopefully going to have that up and running by tomorrow, and then August 4th is the deadline to get in the information needed. So once again, August 4th, if you want to become a provider part of Hawaii UTelehealth, August 4th, to get your applications in for that, and we will have that up on our website as well. We are working with a firm to design and implement a new electronic health record platform that both serves as the EHR as well as the interface for the telehealth interaction, and that is envisioned through having this EHR that all the providers that are working with UTelehealth, we will at least be able to then standardize our data collection, which gets into that next point about formalizing data collection, and then being able to tell our story a little bit better, so that we can continue to receive the grant funding and keep this going. This unique, really, resource within the state of Hawaii and probably within the United States. I'm sure there are other communities around in the country that have that, but for an entire state to have something like this, it's pretty unique. And we'd like to keep that going. And then, of course, continue to, once we, with our data, continue to strategize and to refine our goals and objectives with that. And then lastly, go to our last slide, to conclude with a little vignette success story that we have. And this is from a couple months ago, from one of the providers talking about one of our clients, and just kind of, someone coming in, having feelings of depression and anxiety, long history of this, and of course, the current issues in the world of moving and COVID, took a toll. So met with one of our providers over the course of 3 months, every other week sort of sessions, and refined the goals specific to the client, and provided that psychoeducation that she needed. And through the intervention, her mood improved, her self-worth improved, and she was successfully discharged from Hawaii UTelehealth after 3 months. So, short-term, relatively short-term intervention, big positive impact on the patient, and really kind of helped out that individual. So with that, I will conclude the formal part of this talk and presentation, and open up to questions.
Shoo, that was hard to share those slides because I couldn't see the chat, and I couldn't figure out how to mute myself. Anyway, if you saw the arrow going around and around during that. And I was eating my Shapes Vegemite cheese crackers that I just got sent from students that went to Australia. Isn't that cool? I said, Vegemite, I don't know, but they're addictive. Anyway, okay, let's see here. Who is eligible for services? Oh yeah, you already answered that one. Everybody. We were helping out UH for a little while. What time of wait times do you have now? That is a really good question. They are between 1 and 2 weeks. And it kind of depends if our providers are, I'm sorry, I'm answering these for you, Wes. Go ahead.
Yeah, let's see. I didn't see that question.
No, they're just coming in.
Where?
What kind of wait times do you have for therapy and psychiatry?
Yeah, so with psychiatry is probably a little longer than 1 to 2 weeks. Or with our psychologists, it's 1 to 2 weeks. Well, it depends if
anybody's on vacation. When they're on vacation, that kills us because we have very few psychiatrists.
Yeah, and that's why we're have this new request for proposal out there, is to try to increase the particularly everybody, but we do have a bigger need for psychiatrists, in particular child psychiatry. So please, if anybody knows anybody who might be interested, and this is not a full-time gig for anybody either. A lot of people are doing this part-time, and yeah. So what does a provider need in terms of internet record keeping, malpractice insurance? So do you need a separate malpractice? Do you need your own malpractice insurance? Can't remember the amount of coverage required. It's stipulated in our request.
It's the normal proposals. 1 million, 3 million.
Yeah. Internet is just any standard broadband internet that you have. Record keeping is done through our electronic health record, though I believe there is one group that is doing something separate. Isn't that correct, Dr. Withy?
Yes, so if you want to keep it in your own EHR, you can do that. You don't have to share the records with us. We don't need them. But our new platform will have a free mini EHR. It's not certified, but it is a basic EHR. And if you don't want to use our platform, we can provide a HIPAA compliant Zoom line through UH, but we would rather you use the platform if it works well. We're waiting to see how well it works. Oh, hours. Yeah, go ahead.
The other thing with this is because we're not an insurance company and we're paying you for the services provided to that patient. However, we don't require you to identify the patient to us. There is a level of anonymity that this service provides that that some people who don't want to use their insurance for whatever reason, who want to remain anonymous, do provide. So yeah, I mean, if someone wants to become anonymous and doesn't want to use their real name, wants to use a fake name with you, that's okay by us as well. And just, you know, once again, to try to if that's a barrier, but we want to take that barrier away. I think I answered all the questions about that. Record keeping, no crash. Hours operation is what you decide.
Thank you.
Okay.
Yeah, so what happens usually is our providers are employed or they have their own practice and then they do this, or some the practice signs up, but usually they're employed or have their own practice. So they get their own malpractice and then they say what hours they can do it. So a patient will call our onboarding number, which I believe is 375-2745. Actually, maybe you can share screen and show the website because that has it up there. But a person will email, call, or go to our website and they will talk with our coordinator, whose name is Rachel Snapperman. And she's a pre-med in psychology. And she will then talk to them about what they need, what they want. And then she will contact one of the providers and say, will you take this patient? Here's their situation. They've filled out all the forms, including the ones you wanted, if you want special forms filled out. And the provider will say yes or no and when. And most of our providers like to contact the patient themselves and make the appointment, but Rachel can do it as an alternative. And then every month you bill by zip code and patient initials and how long it took. And we pay therapists $100, the psychiatrist $150, and the child psych $175. So it's not that much, but you can also bill the patient if you talk to them and agree and do that on your own. But we ask you not to bill the copay because we're paying their copay. So basically it is free to them. But if you want to bill their insurance, you can do that. So it does help out some practices because they can bill on top of their insurance. And you decide. Some providers do 4 hours on Sunday, and that's their Christmas spending. And some providers do a lot of hours a week, actually. It all depends on where they are and what time they have. Here's our website. Where'd that phone number go? I think it was just went by. Where'd it go? Where'd it go? Where'd it go? Is that double dipping though? Well, that's a good question. There it is, 375-2745. I think I got it right. Oh no, I think I said 275-3745. Double dipping, is it double dipping? Well, I would say no, but we are paying for your time spent with them. And then you are providing the service. And so you can bill their insurance. But I don't like billing insurance. So personally, I would probably just do it and not worry about the insurance. But of course, insurance is a helpful payment. So we are paying for your time and your copay. Oh, Summer says she can share the flyer, I believe. And Dr. Palmer, should you be contacted to get to the provider panel? And the answer, well, I'll leave that.
Yes, the answer is yes. If you want to become a provider, please contact me.
And we can send the flyer out to the whole group. because we really want to get more people, especially rural individuals who have trouble accessing services. We want to get this to them. So we're going to go to more health groups and let them know, health fairs, let them know, reach out through local rural health associations. And Renata would like your email and contact information, Dr. Palmer.
Sure. I'm going to put it in chat. And there is.
And I wouldn't be fair if I weren't saying UH wants you to have, if you have any employees, they want you to have, is it liability insurance? No, a general liability insurance, and employee, I forget what the employer insurance is, but your standard practices. If you work out of your home with no employees, then of course you don't need that. They want your malpractice to provide, anyway, we get into that when we've got all the information in. So I wouldn't say the RFP process is easy, but we do help everybody with it. So anyway, yeah, let Dr. Palmer know if you're interested, and we will send out a flyer about the Hawaii UTelehealth program, as well as about the RFP. Any other questions? And by the way, Dr. Palmer mentioned the senior computer training, and we have done this for, I believe it's 30 sessions, 350 people just this year. Kaala Souza is the provider, and he is just lovely. He teaches seniors, we give them the computers, teaches them how to turn it on, how to find a browser, how to get an email through Gmail, how to get the free 40-minute Zoom account, and then how to connect to telehealth in general. And we have community health workers on Maui and Big Island that will help people if their computer doesn't work or they don't have internet. We have some, we're working with the libraries, we get them hotspots and can help them go through the onboard process and connect even with their doctors. They don't have to do our platform, but just connecting them up to telehealth in one fashion or another. So if anybody wants that in their community, the computer training, you can let me or Dr. Palmer know. Any last questions? Well, Summer is reminding me, next week is Dr. Andrew Kurtz, Reducing Stigma in Substance Use Treatment. And since we were just at this substance use in rural health in rural communities conference, I'm excited to hear that because we do have a lot of stigma associated with substance use. Does anybody have a case they want to present? Any kind of case? You don't have to have it written up, but remember, we have our, what is it now, $150, Summer? Our incentive. Nobody wants $150. It's only near Christmas people want $150. Because not everybody won a $50 gift card this week. Anything else? Questions, comments? All right, we'll see everybody next week. Thank you very much, Wes. Very nice.
Very interesting. See you guys next time. Thanks.
All right, thank you.
Thank you, Dr.
Let's see all
Palmer.
the thank yous.
Oh, you're welcome.
Yeah. Could one of you email me the